Hey, Paul.
Hey, how you doing, Justin?
We were expecting Tom. It's good to see you.
You got the B team today. The A team's
Yeah,
got other assignments.
softball questions only looks like today. That'll be
That's
nice.
right. You got a break.
Let's dive in because it looks like we might not see anyone else, even though they're seeing us. Um, just to note, I have to get off exactly at 5, so we're hoping to kind of speed through this today. I'm sorry about that. So we have a total of 2,100 cases of confirmed positive COVID cases, and we're up to 83 fatalities. Just a couple other statistics. Career currently has 6 people, as it did yesterday. And our drop-in facility at Blake Field that supports individuals experiencing homelessness that may not be sheltered had 29 people yesterday. So we've seen a steady increase in that site. And we had a good number of people also use the bathrooms and showers at East Rock School. So it's clear that there's a lot of need for that site. A note about nursing homes. We don't have a lot of updates on nursing home numbers, but we are working with Dr. Murphy, who is, as you'll recall, the doctor that's helped us set up the Chapel Street and Day Street site to test all of the residents in both advanced care and Regal Care nursing homes. As you'll recall, Fairhaven Health has tested all of the residents at the Mary Wade home. And so we're excited that we'll be doing this initiative with the other nursing homes, because getting a sense of the overall landscape of how many residents have tested positive empowers the nursing homes to cohort their COVID positive individuals and protect those individuals that are not COVID positive. One other important thing that we're announcing today, before I hand it over to Mike Piscatelli and Adrian Jefferson, is that we're starting to transition now, as our testing capacity increases, to asymptomatic testing. So up until very recently, all of our testing sites have only been testing symptomatic people that have a cough, a fever, et cetera. And because we have more capacity now and are looking to bring on 2 or 3 additional sites in different neighborhoods in New Haven, we want to start testing people that don't have symptoms. This is one of the keys to keeping the community safe and opening up. As the press across the nation has been highlighting, there's a lot of people that don't ever have symptoms that spread the virus because they're positive, or that may get symptoms later as they contract the virus, but maybe spreading it and not know this. And so we want, in particular, the initial focus for the testing for asymptomatic individuals to be on those businesses that are opening up, so that we can keep residents, customers, employees safe. So we're hoping that the press helps us get out the word that we are testing asymptomatic individuals at the Chapel Street and Day Street site. And in particular want hairdressers and barbers, restaurants employees, grocery store employees, individuals that have close contact with the public to get tested. It's also important to note that people shouldn't think that if they're tested once, they're negative for a long time. But by getting tested, you bring a little bit more certainty to your customer base. You are more likely to protect other employees in your establishments. And so we encourage people to sign up to do that. People can sign up at, what is it, coronatestct.com. If they want to make an appointment, they need to make an appointment for the Chapel Street site. Or they can call our health department hotline if they don't have internet, 203-946-4949. We'll start to see, I think, across the state, much more widespread testing of asymptomatic individuals, and we're thinking that this is we're excited to be on the forefront of this this initiative. Mike Piscatelli, can I hand it over to you, and then to Adrian Jefferson?
Sure. Well, thank you, Mayor. Thank you, everyone, for some time this afternoon. You'll recall early on when we first moved into the stay home, stay safe mode, the city worked on something called the Together New Haven platform, which was an ability for all of our economic development and cultural partners to work together to serve our business and creative class communities much more efficiently than if we were all to do it individually. It's such an overwhelming crisis that we're dealing with. But now that we move into a reopen mode, we're making the same transition on the Together New Haven platform. So we've been getting ready for that, and I'm sure many people are now very familiar with the reopen sector rules that are set forth for May 20th. To start that process, what we'll be doing is a series of webinars, an orientation webinar tomorrow at 2 o'clock. The mayor will lead that one. We're very fortunate that Director Bond will join us, as well as our economic development team, to go through sector by sector what those rules are and how we have a safe and successful launch on May 20th and generally beyond that as well. So we'll walk through that in broad overview tomorrow. And then later today, we'll announce a series of more deeper dive technical workshops on Friday. And those will be for specific sectors that are of importance to New Haven to make sure that we maintain the virus under control. Those include the barbershops and beauty salons, as well as commercial office space, because we have so many multi-tenant buildings. And then there's been a lot of talk about outdoor dining. So we'll have the application process ready to go for outdoor dining. And then next Monday, we're going to launch a little bit of a longer haul journey, which is called our Civic Place platform, to look well beyond May 20th, but just to look at the economic and social healing that we'll need to do as a city as a whole. Part of that process is really related to well-being, and you hear quite a bit of people in the news and others talk about market confidence, both among consumers, employees, the public that would go into stores for the first time in some time. And we're really fortunate that Adrian Jefferson and a team of people, we call them our community well-being team, and they've come up with a new internet platform, a new web platform, and is helping all of us get ready for sort of a new world as we reopen, and one where market confidence and well-being and warmth will be very important. So with that, perhaps Adrian, you can give us a little bit of a preview of what the website looks like, and that'll be the platform going forward.
Awesome. I'll share my screen now. So this is our new Together New Haven platform. If you have seen the original Together New Haven site, it did well for what it was meant to do, which was taking aggregated information and disseminating it as quickly as possible to get the information out during this crisis. Because we're going to be with this for some time, we really decided that we needed to have a community-based approach and make sure that the information is connecting well with the community, and that the narrative to which we're relaying the information is connecting culturally to how people actually can relate. So this site pretty much is a reflection of that. When you come to the site, you're able to immediately see exactly what our mission is about resiliency and recovery during the pandemic. And this site, in my opinion, really offers the togetherness that we've been speaking about during this time. You can come here and you can get a lot of the different resources. You can sign up for a lot of the initiatives that we've launched through Together New Haven, such as the marketplace, such as the mask campaign, such as the civic space. And then for the public health information, which is the most important of this, because we need to make sure that people are staying safe during this time, we are listing all of the reopening guidelines as they come out from the state, and as they come out from the city, they will be posted here in a way that's accessible to the public. We also have our digital portals, which are our initiatives that have rolled out from under the Together New Haven brand. So you can see the civic space, Mask Up, and the marketplace. And you can come here and link to those different websites and learn more information. And then when you come down to the community resources, this is really a place where all of the resources we've gathered during this time will live here, and we will continue to update this site so that we have information that's updated and that's relevant to what people need to find. So if it's health and wellness, culture and economy and business, it's all right here. you come down, this is where our announcements will be. And again, it'll be updated on a rolling basis. And then our news feeds from our Twitter and Facebook pages all live right here too. And then you can see our partnerships, which, you know, I think one of the greatest things that's come out of this Together New Haven brand is the fact that we really have come together with many different partners throughout the city to just push this message that we're all in this together, and we're going to make it through this together. And then you just go through the site. You see, I'll show you a couple of landing pages. I won't go through the whole thing, but when you go over to, let's say, health and wellness, we have guidelines. We're looking at what the health department and Marissa Bond, Director Bonds, has disseminated on her website, and being able to have it here accessible and re-linked to her resources and the resources that the city is providing. Health prevention and mask it up. Mask it up is a big one, because we need people to wear masks and stay safe. And there's still some people who are not wearing masks. So again, it's a lot of different, there's a lot of different platforms within this, but there's something here for everyone who is looking for very, very specific information. Small business assistance, you can sign up for the Together New Haven program. We have the contact information, the galleries, everything. So I just think it collectively gives a community feel. When you're on the site, you want to stay on the site and engage with the site. And you want to be able to just find out your resources, and you don't want to run because it's not scary. It's presented in a way that's relatable.
Thanks, Adrienne. And that photo of the ribbon cutting was pre-COVID. Not a lot of social distancing. We were so naive then. Just one more thing to add. The Chapel Street site is actually going to be closed tomorrow, but we'll be reopening on Friday. Any questions from folks? Keep in mind we have like 13 minutes left. Go ahead, Paul.
The emergence of this new child illness, that's kind of one of those new developments make us rethink COVID. How is this affecting what you're doing as a city, thinking about what you're doing with schools, youth programs, summer camps, or health outreach?
I think, sorry. Do you want me to tackle this one, Mayor?
Go for it.
So that's a really good question. I think for us, we were on a call with the Department of Public Health. That is something that we are closely assessing. And so we are expecting a guidance in regards to youth camps. They are closely monitoring the 5 children that were affected and how it correlates with COVID-19. We did issue a memo to pediatricians this week to just also remind pediatricians to really closely monitor symptoms and just encourage testing for children so that we can ensure that we have a more accurate picture of what's happening with children and making sure that they have access to testing as we have made that effort for adults.
Thank you.
Yeah, I think it's something that, like many places in the U.S., we're monitoring. So far, it's impacted a very small number of children. I've had some conversations with the hospital about what they think we should be doing as far as actions. I think at this point, we're, like many other places, trying to determine what the right steps are. Obviously, even though there are not an incredible number of children impacted, being a father, it's a really big deal. Go ahead, Mary.
I understand. I think the testing with Yale New Haven personnel at the nursing home is going to start next week. Is that right?
Hi, Mary. How are you?
Good. How are you?
The testing is going to be happening within the next 2 days.
So this week, the end of this week?
Can
You mean the
clarify
nursing
your
homes?
question? Can you clarify your question, Mary?
Sure. I was on the call with the hospital this morning, and they were just talking about ramping up testing and their contract with the state. Part of it is that with the state, so that's part of, they're supposed to be coming in and helping with nursing homes. I understand.
So that's actually a different question. Sorry, I'm glad that the mayor asked for clarification. You would have to ask Yale what their plans are. Currently, we're just working with Advanced Nursing and Regal Care just to support testing their residents from the city side.
And those 2 facilities, it's Dr. Murphy is coming in to help. Is that correct?
Murphy Medical Associates, correct.
Okay. The hospital also talked about using a van to go around to group homes, to help with testing. They also mentioned possibly setting up tests in schools that are closed now. Do you have anything about that? Understanding?
I think that we don't have a ton of additional information to what you have. And part of that is because this is a pretty fast moving situation. I know that the governor's office is very interested in significantly increasing testing. And clearly, based on the press conference yesterday, the hospital is working with the state to dramatically increase testing. We're doing the same ourselves. The more testing, the better at this point. But we don't have enough or any additional information, unfortunately.
Okay, thank you.
Yeah. Other questions? Go ahead, Paul.
Quickly, you see the number of fatalities continues to climb. The latest batch, are they really mostly older folks now, or who's dying? Who died most recently?
Director Bond, do you know that?
Yeah, so we're closely monitoring the case fatality rate, and it's still 77% of the case fatalities are elderly population.
What is elderly defined as?
Over 60 at this juncture, but the average age, actually I can pull it up right now. Right now we have still the youngest being 26, and then the oldest being 108, but 77% are actually over 65.
Average age is 76, right?
76, yes, sorry. So average age is 76, youngest is 26, oldest is 108, and then most of our case fatalities are individuals of over 65.
Thanks.
You're welcome.
Okay, maybe just one more.
Go for it.
So I know you're always talking about expanding it to the asymptomatic people. Still, it's only limited to Day and Chapel, right? I mean, there's no other changes at the other 4 sites, I guess.
Correct.
Is it is it underused enough? I mean, it would accommodate a lot of people if suddenly people started to go and take advantage of that.
We've had a lot of conversations about this, and I'm planning on putting out a robocall later today to encourage hair salons and barbers and restaurant employees to get tested. And right now it has a capacity of about 100 people a day, and it's at 20. And so over time, you think you can test a lot of people. And obviously people have to sign up so that we can manage any potential significant increase in interest. I think it's better for us to just start working through asymptomatic people and get us accustomed to this. It's also, all of the messaging around the state has been about testing symptomatic people. And up until now. And so I think the public is going to have to, I think the city's going to have to work, and the state's going to have to work on re-messaging around this idea that everyone should be getting tested. And the only reason we've only been testing symptomatic people is because we didn't have enough capacity. Now we're starting to have more capacity. There are some complications with testing a lot of asymptomatic people. There's something like 6 to 8% of the individuals that are asymptomatic that have COVID will end up testing positive for quite a long time afterwards, even when they are over the disease and they are not contagious. And so you may have a lot of people that continue to test positive that may have had COVID 3 or 4 or 5 weeks ago. And if they didn't know that, and now they know it, they may have to self-isolate for 2 weeks, even though they're not contagious. So there are some complexities with this, but from a public health perspective, we believe it makes sense to work to test everyone. And we're starting with those individuals that are more vulnerable, like the nursing homes, or more likely to have to physically or interact with people in closer than the 6-foot social distancing guidelines.
Okay. Is it required? I mean, people coming back to restaurants, barbershops, that they actually do be tested before they open up?
No, the governor's order does not require it. My understanding, I have not seen other places in the state that are doing this. I suspect that this will happen more now as our capacity increases.
Mhm.
We're strongly recommending it. And when you think about that, you're sitting in a barber's chair, and the barber is close to you, in front of you, behind you.
Mhm.
It's very difficult to protect oneself. And so
Right.
this is one step that we can take. I would also suggest, a lot of people, or there are people that are getting dentistry work done. People that are getting the work done in addition to the individuals that are conducting the dentistry work should get tested, so that they're not, because it's a very, very close contact, and people, have their mouths open. So there's risk involved with that.
Okay, I just want to, this is a medical question probably, but if you're asymptomatic, are you just a carrier? I mean, are you always a carrier if it never shows up? I mean, how do you get rid of it? I mean, you could be asymptomatic for a long time. Finally, you find out.
Director Bond, do you want to?
Yeah, so there's insufficient studies right now. It's obviously evolving, and scientists are trying to get just to get a better picture of their incubation period. So that's really a difficult question to respond to, honestly. However, we do now know that it can last in someone's symptoms up to 40 days, although they may not be symptomatic. And so we have to make sure that we're closely monitoring that. As research gets published, we're obviously trying to keep up with that to make sure that we are providing the latest information.
Thank you.
Doesn't make it easy.
Unfortunately not.
Yeah, it doesn't make it easy to understand, but it definitely doesn't make it easy to message to everyone what the right thing is to do.
Right. I hate to make this reference, but it sounds like Typhoid Mary. Just carrying it.
You're dating yourself, Mary.
Paul knows it better.
Yes, I do.
Can we do one last question? Or none last questions? It's up to you.
One last question.
Going once, going twice. Thanks, everyone. It's always good to see you. Take care.